interested in, and sleep has been a big one. I guess most of us, we like to sleep, and as we age, sometimes we don't sleep as well, or we're not thinking we're sleeping. We'll hear more about that from Dr. Moore. So we're delighted to have Dr. James Layne Moore today. As I said, sleep has been our most requested topic. He is a highly regarded sleep medicine and neurology physician at Baptist Health. So we welcome him this afternoon to lead us through this conversation. And again, I encourage you to complete your evaluation and your survey. So welcome, Dr. Moore.
To make sure that my microphone is on and working. Can you hear me?
Yep.
Yes, sir.
Okay. So, I will do my best to be heard, and I recognize that this isn't as easy to read as one might like, but if the opportunity for clarification if something isn't clear, okay? Okay, so why do we sleep? The obvious reason that you feel, maybe I'm too close to the...
No, is it giving feedback?
It's just a little bit of feedback, yeah. So the most obvious reason is that you feel sleepy, right? And so we call that S drive, that is sleep drive, or sleep pressure. And the longer since you last slept, the greater that sleep drive. And then the other drive is circadian, circa dia, about a day. So both of those ideally would be used to have you go to sleep, and so that you would recognize if during your sleep period you wake up towards the end, it's harder to get back to sleep than it was at the beginning. Beginning of sleep, your sleep is the most dense it will be. It is the hardest to wake you up. You'll have deep sleep early on, and the sleep is deep later on, towards the end of your sleep period. But the first part of your sleep cycle, it'll be harder to wake up. And that's because the sleep pressure, or S drive, gets decreased as you sleep. So that you're sleepiest when you go to bed, but when you wake up later, you don't have as much S drive or sleep pressure. So that's why. So you think about the other component, the circadian rhythm. You do best, your brain does best, the clock does best if you get up and go to bed at the same time. So ideally you would use both of those drives to go to sleep. That will help you go to sleep consistently. So circa about a day, and there's this plant that I won't try to pronounce other than mimosa. There was an experiment looking at circadian rhythms, and this investigator put a bucket over this plant. He had watched it follow the sun. It would follow the sun. He put a bucket over the plant and then picked it up and observed it still following the path of the sun, even though it couldn't see the sun. That was the first time that scientists had demonstrated a circadian rhythm. We have a circadian rhythm. In fact, as far back in the phylogenetic pathway of organisms, blue-green algae have circadian rhythms. So it turns out it seems most efficient to do certain activities certain times of the day, and that's the sun, light, is what gives us, resets it for us. And the pineal body in our brain, up here at the top, is our messenger for when it's time to go to sleep. It secretes melatonin. I remember when I was a little boy, for whatever reason, we were talking in class about the pineal body, and it was my job to find out about that. And I spoke to my own physician. This is really his name, Dr. Love, Dr. Robert Love, and he loaned me one of his books. I went home and read about it. And that medical textbook from 40, 50 years ago said it was vestigial. They didn't know what they thought the pineal body didn't serve any function, just like they said about the appendix. But turns out it does, and it secretes melatonin, which helps prepare for sleep, part of the circadian clock. All right, the pineal gland. Now the other thing that this is a segue to is lights. Now, why do physicians such as myself tell you not to have lights on in the evening? Well, the reason is it's messing with your circadian clock. Your circadian clock is resynchronized every day by light, and until recently that was the sun. Now we have lights that artificially keep our evening illuminated. Okay, so now that makes your brain think, oh, it's not as late as I thought it was. It moves your circadian clock back. Well, what does that do? So that takes away your circadian drive to go to sleep. Now you still have the sleep drive, the S drive. I mean, you still might be sleepy, but you'll sleep better if both of your drives tell you to go to sleep at the same time. Okay? So this is just a picture showing you the pineal gland here secreting melatonin, and Z's to indicate you should be sleeping. All right? So, sleep drive, sleep pressure, sleep deprivation, all those things make you want to go to sleep. Now, I don't know what you guys studied in school, but one of the things that I studied in high school was energy in cells. ATP, ADP, AMP, right? And the difference between all those is you're cleaving off an adenosine. So it turns out our clock uses those cleaved off adenosines to keep track of time. And that's how it does this. Now, we can block that sensitivity to adenosine with a particular element that's used to allay our sleep onset. Caffeine blocks the adenosine receptors. That's why caffeine helps you stay up later, or is a stimulant, because it blocks the adenosine receptor. So, why don't we sleep well? What goes wrong with sleep? So I'm going to talk about that. In the end, I'm going to give you some ideas for how you would optimize your sleep. Okay? Sleep now has 4 stages. Back when I was training, used to have stage 1, 2, 3, and 4, but we got rid of 4 and put it into 3. The stage 3 is deep sleep. And if you have kids, you know how hard it was to wake them up? They spend a lot of time in stage 3 sleep. We don't spend as much time in stage 3 sleep. And certainly towards the end of the sleep period, not much at all, because it's easy to wake up and it's hard to go back to sleep, right? So, stage 1 is drowsiness. And so some of you may enter stage 1 as I keep yammering on. Stage 2 is light, and you would partly remember what I was talking about. Stage 2 you won't remember. These have a particular pattern called spindles, and you won't remember anything during stage 2 sleep. Stage 3 sleep is very deep sleep, and your body, your brain really likes stage 3 sleep because it's very beneficial for a number of aspects. And then rapid eye movement sleep, or dreaming sleep. Now, some of the dreams can be outside of REM sleep, but classically you think of REM sleep as dreaming sleep. And so, the first part of the night, we'll get more stage 3 sleep, which is why we're hard to wake up. That's dense sleep. Second half of the night, end of the night, we're going to get more dreaming or REM sleep, and you're not as soundly asleep, and you'll, if you wake up in close proximity to REM sleep, you might remember your dreams. Okay? Now this is a little depressing, but I'm going to show you. You're old enough to know this. So you look at slow wave sleep, stage 3 sleep. Well, look what happens as you get older. Smaller and smaller and smaller, right? Why does that matter? Well, first of all, you wake up, right? Second thing is, deep sleep, stage 3 sleep, is really important for integration of memory. There's research that shows if you, there's at least a couple of studies where in scientists, we like to have matched sets. So one set of people, well, two groups of people, one each had to learn a task. One got to sleep before they were tested. One didn't get to sleep before they were tested. The group that got to sleep did better. They knew better memorizing and learning things and learning physical skills. So my tip to you is, if you want to learn something, learn it and sleep on it, and then you'll be better at it. In fact, one of the books I'm going to recommend says a pianist came up to him and said, doctor, when I can't play something, sometimes after I sleep, I wake up the next day and I can play it. That's an example of what might happen. All right. So REM sleep, slowly sleep. So this is, so this really starts at 5. If we went back to birth, it'd be even higher. And kids, they're learning faster. They learn faster than we do, but partly is that they've got more deep sleep, right? And look what takes its place: light sleep, stage 2 sleep. Okay. Common disorders. What I see the most of is sleep apnea. Paneus, P-N-E-A-U-S, I think it's, I didn't take Latin, but I think it's Latin. It means spirit or breath. It could be Greek, but it means spirit or breath. And A, no breath, no spirit. And so if you don't breathe for 10 seconds, that's an apnea. Now, if you have more than 5 of those in an hour, we give you the diagnosis of sleep apnea. We added 5 apneas, and we give you the diagnosis of sleep apnea. So some people I see have 50, 60, over 100 an hour. They're very sleepy. You can imagine, right? So obstructive sleep apnea is when the airway is blocked, most common type, and it gets blocked behind your tongue, back there, the oropharynx. And then there's central sleep apnea, where your body is not giving appropriate signals to breathe. And that can be because you have a neuromuscular weakness, or because your brain doesn't send the signals out. Okay? And then the other things I see: insomnia, can't sleep, either can't fall asleep, can't stay asleep, or both. Hypersomnia, too sleepy, can't stay awake, always tired, want to fall asleep when you're driving. And then parasomnia. Parasomnia is a behavior, an undesirable behavior in sleep, and that can be sleepwalking, sleep talking, nightmares, REM behavior disorder, where you're fighting with people in your sleep. You can injure yourself or your bed partner. Any questions about any of these? Okay, what are the risks for sleep apnea? Big time. Now, anthropologists tell us that our jaws are getting smaller in the past 100,000 years or so. And I had the opportunity to go last July to Trondheim, Norway, and for Mayo Clinic Alumni Association has international meetings every 2 years, and that's where it was. Now, Trondheim is where the Viking center of power was in Norway. It's up north of Oslo, and they had a museum of natural history, and they showed Vikings from 500 years ago and from 100,000 years ago. In fact, the jaws were bigger. I took pictures. I need to put it in my talk, but our jaws have gotten smaller, but our teeth and our tongue haven't gotten smaller as quickly. And as a measure of that, maybe most of us have to have our wisdom teeth out because we don't have room for all of our teeth. We don't have enough room for all of our tongue, too, and that blocks our airway. If you have a large neck, that makes the airway small. If you have a family history of sleep apnea, independent risk factor, getting older, just more rings around the tree. Even if you're the same weight, your risk goes up. You have less collagen, everything's a little stretchier. Smoking is an independent risk factor. Consuming alcohol or sedatives before bed also decreases your ability to protect your airway, leading to obstructive apneas. Or symptoms, I guess. What are the symptoms of sleep apnea? The most common is loud snoring. When I see patients for sleep apnea, almost all of them have a history of snoring. The only time I don't get a history of snoring is no one sleeps in the bed room with them, right? And that's actually pretty common. I'm amazed how many people sleep by themselves, either because one person snores or the other one moves around too much. Okay? Daytime sleepiness, but sometimes people are sleeping for other reasons, but morning headaches, that's another thing I hear. Or a dry mouth. Irritability. We see that particularly in kids. Kids can't focus, they're grouchy. As adults, we've learned that when we're grouchier, we learn to suppress it. The kids can't very well, they're irritable. People will often witness apneas, bedroom partners, or gasping or choking arousals are things I hear. So the airway collapses during inspiration due in part to relaxation of the muscles. So when you're breathing in, your lungs are like a bellows. They're pulling a vacuum of air in. That's already trying to collapse the airway. And when you're asleep, your muscle tone is lower. And the airway can collapse. And then what happens, you usually make a sound. Or after the airways collapse, you're making no sound. And then your brain becomes anxious because you're not breathing. And so what does your brain do? Well, your brain makes you wake up a little bit. You get to a lighter stage of sleep. So somebody that has sleep apnea will not necessarily come in and go, you know what, I think I have sleep apnea. In fact, they never do. In common scenarios, my bed partner, usually the woman to the man, says, you snore really loudly, you need to address this. Because you don't wake up enough to remember it. And this is the tongue, which becomes the big problem. If you have a big tongue, it makes that airway small. Just wanted to show you that. And as you can see from this, if you lie on your back, gravity is going to make it a bigger problem. It's going to make the airway even smaller. Now, I said there's the most common is obstructive apnea, and I showed you an example of that airway obstructed. We call that space behind the tongue, the oropharynx. Central apneas are less common, but nonetheless a significant problem. And this is where their brain isn't able to get them to breathe. And that can be because they've had a stroke, or the brain's damaged, and so the signal processing either to sense that you need to breathe or to make it happen. Neuromuscular diseases like myasthenia gravis or Lou Gehrig's disease cause people to have central apneas. Heart failure, because the circulatory time is prolonged, and so when the blood gets to the brain, it seems like it's got enough oxygen, then it takes a long time to come back, then it doesn't have enough oxygen. So when it says it's got enough oxygen, you don't breathe, and then it says you don't, and that long period of transit, simplistically, I'm simplifying it, but that causes them to breathe and then not breathe, because the circulatory time takes so long. And I would show you that, but it's too small. But trust me, that's the heart and the circulatory system. All right, nightmares. And I was really proud of myself. I've been here about a year and a half, but I already know horses are important in Kentucky. And so I've got a picture of a nightmare here for you. Where does that term come from? The Old English term, mare, described a mythological, malevolent, bad, evil spirit that would sit on your chest during the evening and cause suffocation. Yeah. Originally referred to a female demon or goblin linked to sleep paralysis and terrifying dreams. That's where the term comes from. Okay. Nightmare versus night terrors. This is more of a kid thing, but nightmares really come out of dreaming or REM sleep. If kids have a nightmare, you can console them, or a bed partner, and wake them up and they'll be consoled. Night terror is in deep sleep, stage 3 sleep, and the more you try to arouse the child, the more irritable they become. So that's one distinction. In our population here, you're just not going to see night terrors. Okay. So I see people, one of my earlier slides said hypersomnia, which means too sleepy, right? Why are people too sleepy? Well, not enough sleep. And so I commonly see people that go to bed too late and they have to get up, they don't have sleep. They have a sleep debt, and then they try to make up on the weekends if they're working. Or they have something wrong with their sleep. They have sleep apnea. And if you look at their sleep, it's constantly interrupted, so they're not getting the ratio of deep sleep that they need. So if I took away your light sleep, you wouldn't miss it as much as if you missed deep sleep. So that if you do a sleep study on people that are sleep deprived, like residents, doctors, or firemen, or anybody who's sleep deprived, you would see that the first night after they were sleep deprived, their brain will sacrifice the light sleep to make up stage 3 deep sleep. And the second night, it'll sacrifice other portions to make up the dreaming or REM sleep, because it's so much more important than the other areas, the other portions of sleep. So, poor sleep hygiene. You're not consistent. People, you don't go to bed at a good time, or you've got lights on, or you drank caffeine or bourbon or something at night before you went to sleep. You got to get up and go to the bathroom. Shift work disorder, working shifts. Chronically sleep deprived, because when you're working nights, you wake up to be with your friends or family, and then you gotta stay up basically all day and then work all night for the shift again, the next night shift. In fact, shift work is associated with increased risks of breast cancer in women, and we think that's because stage 3 sleep is deprived. And stage 3 sleep is when your immune system does its best work. You notice when you get sick, you get sleepy. Your body makes tumor necrosis factor to make you sleepy. Well, that's when your immune system is doing its best work looking for the viruses. It's also looking for cancers. So that's another reason you want deep sleep. Parasomnia, sleepwalking, fighting with people, sleep apnea, all these things add to not enough sleep. And then there are the conditions of central hypersomnia, where they've got enough sleep and they're still sleepy. And the most famous of that is narcolepsy, and with or without cataplexy. Cataplexy is when you get weak. So if you're really sleepy and you got enough sleep, then you have central hypersomnia. If you fall asleep quickly and you hit REM sleep, we call you having narcolepsy. If you don't go into REM sleep, we call it idiopathic hypersomnia. Now, during dreaming or REM sleep, you should be paralyzed, so you don't act your dreams out. If that happens, and you get sleepy and you hit REM sleep and you get paralyzed, what happens? You get weak. So that's one of the things that people that have narcolepsy with cataplexy will have symptoms of weakness. And you can see videos of Doberman pinschers and goats and horses that they collapse when the onset of REM sleep. All right. So how is sleep good for you? Memory and learning. I told you, and I'm going to reiterate, that you learn best if you get to sleep after you learn a task or a body of information. And we know this because we've done experiments, as we do, and we find that you learn things if you get to have some stage 3 sleep and integrate those memories. It's important for learning. Now, another thing that sleep does is researchers at Stanford, their sleep center is one of the best in the world. They found that you've heard of the lymphatic system. We have a lymph system, and that gets fluid back. Well, you think about it. Everywhere you look, we have an internal skeleton, right? Not bugs, except our head. We're bugs. The skeleton's on the outside because the brain's soft. Well, we can't really have a lymphatic system there. But what we have is during deep sleep, the glial cells pull back a little bit to let the sort of channels open, and that's during deep sleep we get rid of some of the breakdown products, and we call that glymphatic system because in the brain the connective cells are glial for glue, derived from Latin for glue. Glial cells pull back and get rid of the lymphatic system. So theoretically, getting good sleep might also protect against Alzheimer's and Parkinson's disease because you get rid of breakdown products. Alzheimer's disease and Parkinson's disease and other degenerative conditions are associated with collection of breakdown products in our neurons. Okay, so healthy sleep helps us with learning, memory, getting rid of breakdown products. It helps vascular health too, so that your vessels remain healthy to your heart, to your brain. The cardiologists have compelling literature that if you have sleep apnea, significant sleep apnea, you have more heart disease, more cardiac arrhythmias, your heart doesn't beat properly, and there's certainly evidence of increased risk of strokes. So these are the reasons healthy sleep is good for you, among the reasons, okay? So, good sleep helps the blood vessels not get clogged, less atherosclerosis. There's those experimental cats where during sleep they cut the oxygen off and noted increased plaque deposition when they induced apnea, because what happens when you stop breathing, your brainstem gets anxious and the fight or flight response comes on. Autonomic tone goes up. This probably accounts for why apnea is associated with hard to control blood pressure, increased vascular disease. It's like your brain's panicked a lot during that. So when we get cardiac arrhythmias, atrial fibrillation, when your heart doesn't beat properly, if your heart doesn't beat properly and blood isn't moving, you can form a clot, and then you got a stroke. Atrial fibrillation is a commonly associated problem with sleep apnea. Weight gain. Being chronically sleep deprived increases your risk of gaining weight because your stomach secretes ghrelin when it's empty. So it's hungry, let's eat. But when you're sleep deprived, it secretes ghrelin when it's not empty, making you eat more ghrelin. And then from fat cells, the fat cells should secrete leptin to say that they're full, but when you sleep deprived, they don't. So you get secretion of ghrelin telling you're hungry, and you don't get secretion of leptin from the fat cells saying, hey, we're full, we don't need any more. So, two ways that being chronically tired increases your risk of gaining weight. And I remember when I was an intern, which is probably the most sleep deprived I ever was. I was the most overweight until lately. Because I was just eating all the time. Your immune health, I actually jumped ahead and mentioned this, but deep sleep, stage-free sleep, is when your immune system's doing its best work looking for infections. So when I get sick, the thing I do is I go to bed and get as much sleep as possible, because you want to make it easy on your immune system, and we have evidence it protects you against cancer because your immune system's looking for cancer cells better. Okay? All right. Now I'm just going to briefly talk about tests. I know it's not exactly what you want to hear about, but for sleep apnea, if we're just worried about sleep apnea, we can do the home sleep test. There's a variety of them. At Baptist, we do one by Phillips. It's got a band on. I think I have it right here. It will measure respiratory effort, will measure airflow, and your oxygen saturation. The polysomnogram, multiple, somno, sleep, gram, write it down. This is the gold standard, and this was the one that was originally developed probably in the 1950s, University of Chicago. Sleep medicine is actually pretty young science. Multiple sleep latency tests. I told you some people come to me and they're really sleepy, and I told you there's idiopathic hypersomnia and narcolepsy. The way I tease that out is I have them do 4 or 5 sleeps in the lab. I see, do they fall asleep too quickly? And if they do so, do they get some REM sleep? And that's how I separate those two disorders. And then actigraphy. I told you sometimes people have bad sleep hygiene. They don't go to bed when they're supposed to. And they come in and tell me they're sleepy. Well, I'll put this actigraphy on them. It's a watch that will tell me when they're sleeping and when they're not. Now this is a new device, a watch pad that we used to use at Mayo Clinic a lot. We don't use it here, but it's just a watch and PAT, peripheral arterial tone. It's a probe goes on your finger. That's why they call it watch pad. That's one of a few. This is what we use at Baptist. You're going to wear in your chest. It's going to measure airflow. It's going to have a band that will measure respiratory effort. And then the other test is the polysomnogram, where we've got you hooked up. We've got 2 bands, and we've got electrodes in your head, so I can see what stage sleep you're in. No other test can we really tell what stage of sleep you're in, other than the study in the lab, polysomnogram. Of course, I like that, but people commonly want to sleep at home, and I get that. This is the electrode box that they would wear. So this would be in the lab. It would be somebody watching them or monitoring them all night. And this is a multiple sleep latency test. And it shows that this patient falls asleep in 3.3 minutes. You know, less than 10 is sleepy, less than 8 is definitively hypersomnia. Now, do they have narcolepsy? How do we tell who has narcolepsy versus who doesn't? Anybody remember that? REM, dreaming sleep. Did they get dreaming or REM sleep? 1, 2. 2 onset REM sleep. They have narcolepsy. Yeah. All right. And this shows their sleep stages, that they, I guess a little bit of deep sleep there. And this is actigraphy, where somebody will wear for a week or 2, and this is kind of a mess. You'd like to see it, you'd like to see consistent chunks of sleep, consistent chunks of wake. There's a couple here that it's inconsistent here. See, this part, and this part, and this part are not lined up. That would be lined up very nicely. Now, there are people who the circadian clock just doesn't work. It's free running. And I have a few of these patients, and they can't stay at school, they can't keep a job, because no matter what they do, they keep going to bed later and later, and then eventually they just can't get up for work. And I have a couple, and this is one of them. Now, what I want you to notice here is this is a couple weeks, but see how the schedule keeps moving. They were in actigraphy, and it keeps moving. Eventually, they are unable to get up for work because they fail. And so we have medicines that are like melatonin, but stronger. They were approved, but it only works for 28%, 20-some%. And I have 2 such patients, and this is one of them. This is textbook, and that's why I say that it's kind of pretty. But I have not been able to get him controlled. So life's very hard for him. So, in summary, how to have the best sleep. This is the money shot. have a consistent bed and awake time, and you should have 8 hours sleep opportunity. If you look at a curve, who lives the longest? 7.5 to 8 hours. That's optimal. That's what I try to get. More is not a problem, but 7.5 to 8 hours. Okay? You won't find this in the handout because I added that because they told me that they wanted it, so sorry. So I added this. They didn't pay any extra for it. So, and you want the room dark and cool. 68 degrees is optimum temperature for a sleeping room, according to the research. So time, temperature. Don't watch TV or use a computer or iPad right before bedtime. Why?
The blue light?
The light, that's right, the light. The light. The light tells your brain, oh, it's not that late. Good. Don't drink fluids before bed, you'll have to pee. Alcohol will make you sleepy, but it's going to suppress your REM sleep later on, and you'll have to pee. And caffeine. Caffeine is going to make you, it's going to suppress your S drive or sleep drive, right? And you won't sleep as well. You might think you do, but if I was to study you in the lab, I could demonstrate that your sleep is measurably poorer if you've had caffeine before you go to bed, within 3 or 4 hours. Now, exercise improves deep sleep as long as it's more than 3 hours before you go to bed. Okay? Exercise does improve your deep sleep. And a warm shower or bath before bedtime helps you sleep better. And it's not for the reason you think. It's because as your body is cooling down, it goes to sleep. Because you got warmer when you're in the shower. As it's cooling down, you go to sleep. Same reason being in a cool room. Your body cooling down, it's ready for sleep. So in an ideal scenario, body's cooling down, it's dark and quiet. Doesn't take very much light to make your brain think, oh, it's not bedtime yet. All right? Resources, I've given you some here. This is the American Academy of Sleep Medicine Healthy Sleep videos. You can go to the American Academy of Sleep Medicine, healthysleep.org, and here are videos that you can look at. I'm not going to read them to you, but there's a number of them, free. And it's from the American Academy of Sleep Medicine, so you can trust it. And then I have some books that I like that take pictures of mine in my bookshelf at home. These three. And Why We Sleep by Matthew Walker is a PhD. That's my favorite if you were going to read one. Mayo Clinic, a couple of my colleagues, this just came out 2025. Two of the smartest people I know about improving your sleep. One's a psychiatrist, one's a previous president of the American Academy of Sleep Medicine. And then this is more esoteric, but Mapping the Darkness talks about the development of the science of sleep medicine. And one of those stories was the researchers, Kleitman and his research assistant came. So I told you that we have this circadian clock, and it gets reset by lights. Well, they wanted to study what would happen if there were no, as the Germans called it, Zeitgebers or time givers. What would happen? And they came down here to Mammoth Cave and stayed for a few weeks to watch their cycle. Yeah, they were from Chicago when they came here. All right, questions? Yes, sir.
You said something particularly interesting. It's on slide 19. Talked about the brain and memory, and during sleep, how some of the lining shrinks and it helps the brain clear out debris, things along that line. And then you mentioned that it can reduce or may reduce the risk of Alzheimer's and Parkinson's. I'm wondering, is that theory or is that actual science?
That's theory. So the question, hopefully I'm going to reiterate it appropriately. The question was, when I was talking about the lymphatic system in deep sleep, and it was a time where they identified that breakdown products And the breakdown products in neurons are often, they have little microtubules. So to move things from the cell body down and back, those break down, and that's the sticky, gooey stuff. So they definitely find that they get rid of breakdown products. His question, I believe, is this observational? Is there evidence that shows that it protects against that? There's not evidence. This is a relatively new discovery, and so we're looking at that, but that's not been answered yet. So this is theoretical,
Okay.
but I still am doing it in the meantime because, yeah, good question. Other questions? Yes, ma'am.
Not to get too personal.
Not to get too personal. Oh.
Okay, so I'm obese.
Uh-huh.
I have type 2 diabetes.
Yes.
I tried Ozempic.
Uh-huh.
I lost weight, but it had other side effects.
Okay.
I sleep in a recliner, really a lift chair, where my feet are up higher than my heart for other issues.
Okay.
When I do wake up during the night, maybe I have to pee, maybe I'm thirsty, whatever. I have to get out of that chair, I have to get back in that chair. So my sleep cycle is screwed up.
Okay.
I'm sometimes awake an hour, but the first sleep I go right away, which is what you said. How does sleeping in the lift chair helps my lymphedema,
Okay.
helps my heart,
Okay.
but not getting that hour sleep I'm missing, I'm getting less than that 7.5. So I'm screwed, right? I mean,
Well, do you have sleep apnea?
I was tested and they said I did not go on the CPAP machine.
Okay. Well,
I know, I'm doing all the wrong things.
well, you're not doing all the wrong things, but if you're asking me to optimize your sleep, is that losing an hour? Is that harmful? Well, it's better if you've got 7.5, 8 hours sleep. Doesn't mean that you're going to get everything bad, but all I'm looking at is you're playing the odds, right?
I guess.
And so if I were advising you, and I guess I am,
Yes, I asked so.
I would treat your sleep apnea, and you might get up less often because when you have sleep apnea, you get something called natriuretic peptide. The heart will make you pee, diurese when so if you have obstructive sleep apnea, you're making a bigger vacuum to pull air in because it's obstructed. Well, your heart, in response to that, thinking that you're in heart failure, makes natriuretic peptide that makes you pee more. So sometimes people find that when sleep apnea is treated, they don't have to get up to pee as much.
I'll take that into consideration. I was married for over 30 years to a gentleman who was on the CPAP machine, and unless they make it quiet, it would keep me awake.
Well, the only noise it will make is if there's a leak. They don't make any noise. So,
The air float, does it make noise?
no, ma'am. No, I mean, if there's a leak, but yeah, they're pretty quiet. Yeah. I have one. Yeah.
Okay, thanks.
So, yeah, I'm not making that up. All right. Other questions or comments? Yes, ma'am.
Sometimes, for whatever reason, your system seems to either get used to or train itself to sleep a smaller amount of time. Is that always damaging, or
So
say
your
my average amount of sleep is 5 hours?
So your question to me is, if you got used to sleeping a shorter period of time, does that harm you, and can you get stuck in that?
Right.
Is that
Correct.
Okay. Yeah, it's not good for you, I see that a lot, actually. I see people who have worked shifts, work nights, and they sometimes it feels like they never get back on track. In fact, I don't sleep as well, honestly, since I've been on call for so many. I'm not on call here anymore, but for so many years on call, and having kids. I think having kids, you're just always on alert. So, yeah, I think some of those things might be pretty chronic, but you know, my advice to you is, well, you optimize everything else. Optimize everything else. You know, consider making sure you got time for sleep. Optimize everything we talked about. Take some melatonin. Melatonin's a hormone your brain makes anyway. Try to optimize what you can do. I mean, there's certain things that are suboptimal, but there are things you can optimize. Yes, sir.
All right, I'm a 2-pillow sleeper. Is the theory of a 1 or 2 pillow better or worse, or is that more of a placebo effect, I guess you could say?
Why do you want 2 pillows?
I like having my head elevated a little bit.
Well, some
See,
people
like
like,
a little more soft.
some people like, and so generally it doesn't make any difference. Some people need pillows because they have trouble breathing when they lie flat. I think you have it because it's more comfortable.
Yep.
I don't know of any evidence that says that that's bad. I have 2 pillows, so, and depending on the night, I move one, but there are people that have to sleep up because, you know, sitting up because they have a heart or breathing problem, but as long as that isn't the case, I don't think it matters. Okay? Yes, sir?
What about sleeping on your stomach?
What about sleeping on my stomach?
Yeah, that ain't good.
Well, some people like it. It pulls your tongue forward. So on your back, you're more likely to have obstruction than sleeping forward. First, I don't want infants to do that, but if you like it, that's fine, as long as you can breathe all right. You know, a lot of people do that. You know. It's okay.
Is it possible that these times that you're awake at night and you're just lying in bed and worrying that you're not sleeping, are you really sleeping maybe?
Well, most people sleep more than they think they do, and so like last night, I had a busy day today. I had to go in for a test this morning at 7, and so I had to get up early, and I had to go to the clinic, and then I had to come give a talk, and so I didn't sleep well. I had a lot on my mind, and I wake up, and one of the things you don't want to do is be able to see your clock, and so I can't unless I tap my bedstand, and I did that, and so most times you put people in the lab, they sleep more than they think they do, but you're in light sleep. Yeah, most likely. Yeah. Yes.
Yes, 2 years ago I was diagnosed with a mild case of sleep apnea, and I'm just curious, my cousin uses this machine called So Clean to clean it up. What is your opinion on that?
Okay, so the question is, what do I think of the So Clean machine to clean CPAP machines?
Is what now?
To clean.
So, what do I think of the So Clean machine to clean CPAP machines? Is that right?
Yes.
Okay.
Yeah.
I don't like them. You don't need them. William Shatner made money selling them, but what they do is they make ozone. Ozone are 3 atoms of oxygen together. They're highly reactive, and it probably does kill viruses and bacteria. But it caused a crisis for us because the Philips machines, the biggest maker of CPAP machines in the world, some of those, under the right conditions, hot, humid environment, would have some of the plastic break down and form little pieces of plastic, and so then there was a theoretical risk of cancers. It could be carcinogenic, and so Philips ended up replacing, you know, tens of thousands of those, and ultimately pulled out of the U.S. market. I don't see any research that shows they improve anything, and they're oxidizing your machine. They can damage your seal. You're just pulling air in from the room. So I don't use one. We didn't recommend it at Mayo. I don't recommend it here. I would spend the $300 on, you know, something better. Yeah. That's what I think. All right. So I'm going to wrap up here in a second. Okay. Any other questions? All right. 2 more.
You made a statement that you shouldn't be seeing your clock at night. What's the theory behind that?
Well, because it makes you worry about it. Now you know you're not awake, and you start worrying about it. And then there's a condition called orthosomnia. Ortho meaning straight or correct, and you're worried you're not sleeping. You'll ruminate more about it if you can see it. So we recommend you don't. I have an iPhone and an Apple Watch, and it doesn't show the time unless I bump, if you get up, it'll show, or if you bump it. So I try, that's what I do, but you shouldn't look at it because you're worried about it. All right?
I wondered about the appliance. Some people are talking to dentists about it.
The mandibular advancement device. Yeah, oral mandibular advancement device. It's like a bite guard, pulls your jaw up, and it can move, because your tongue is attached to your jaw, it'll move out a few millimeters. And if you have mild sleep apnea, very mild sleep apnea, that might work. If you have severe sleep apnea, it won't work. It can give you TMJ pain because it's pulling your jaw forward out of your TMJ, out of your joint. And if you do, and you can't do it if you have dentures, and if you apply steady pressure to your teeth, well, you move them, right? That's how braces work. So, some people don't want CPAP, they want to try other things, and that's fine. I have a dentist that does that, but I've also had dentists that don't want it, so it's another option, as is the Ozempic for weight loss. Yeah. All right? Good.
Thank you, Dr. Moore.